Imagine a body that defies the laws of nature. From heartbeats visible through the skin to the rarest genetic anomalies, these women live the impossible. Discover 10 extraordinary clinical cases that are shaking the world of science today. Number 10. Elizabeth. Hyperlactation syndrome and humanitarian commitment. The first case concerns Elizabeth, a woman whose body possesses an extraordinary physiological capacity: hyperlactation syndrome. While a typical nursing parent produces a standard amount of milk to meet an infant's needs, Elizabeth's body generates between 1.5 and 1.75 gallons, over 6 liters, of breast milk daily. This condition is linked to an atypical hormonal response, often associated with extremely high prolactin levels or increased sensitivity of the mammary receptors. Although this situation is physically and emotionally exhausting, requiring constant cycles of pumping, cleaning, and sterilizing equipment, Elizabeth transformed this challenge into an unprecedented humanitarian work. Since 2015, she has donated nearly 16,000 liters of milk to specialized banks. This gesture has helped feed thousands of premature infants whose mothers could not produce enough milk. Her case, validated by the Guinness World Record, illustrates how a glandular anomaly can become a vital resource for global neonatal medicine. Number 9. Yamini Kuranam. The complexity of the cerebral teratoma. Yamini Kuranam, a brilliant 26-year-old PhD student, began suffering from subtle cognitive impairments, affecting her reading and oral comprehension skills. Concerned about this sudden decline, she consulted neurologists in Los Angeles. Initially, imaging tests suggested a classic brain tumor lodged deep within the brain. However, during a delicate surgical intervention, surgeons discovered a much more surprising reality: a teratoma of rare complexity. A teratoma is a tumor derived from pluripotent germ cells capable of differentiating into any type of human tissue. In Yamini's case, the mass contained bone, hair, and even teeth. While some researchers debate the embryonic origin of these masses, sometimes viewing them as attempts at twin development in utero, Yamini's case notably marked science due to the delicate location of the tumor. Thanks to a minimally invasive surgical technique, the mass was successfully removed, allowing for a total recovery of her cognitive functions and providing a valuable case study on cellular development anomalies. Number 8. Virsavia Boren. Living with pentology of Cantrell. The case of Virsavia Boren illustrates an extremely rare congenital malformation known as pentology of Cantrell. This condition is characterized by a major structural defect during embryonic development affecting the thoracic and abdominal walls. Consequently, the heart, and sometimes other internal organs, develops partially outside the usual protective cavity. In Virsavia's case, her heartbeat is visible directly beneath a thin layer of dermis because she lacks the bony protection of the sternum. Despite the permanent infection risks and major physiological complications associated with such organic exposure, her survival into childhood is considered by the pediatric community as a true medical miracle. Her exceptional resilience has required constant multidisciplinary monitoring in the United States, involving world-renowned cardiac surgeons. Her journey has become a scientific reference for the study of midline defects. She continues to defy medical statistics, living an active life while raising public awareness for this orphan pathology that requires constant surveillance. Number 7. Lizzie Velasquez. Neonatal lipodystrophy syndrome. Lizzie Velasquez was born with a condition so rare it affects only a handful of people worldwide: marfanoid progeroid lipodystrophy syndrome. This pathology prevents the body from storing any body fat, forcing Lizzie to consume many small portions of food throughout the day to maintain her energy levels. In addition to the absence of adipose tissue, this condition also affects her vision and immune system, giving her a prematurely aged appearance. Rather than letting herself be discouraged by medical challenges and the cruel bullying she faced in her youth, Lizzie became one of the most influential motivational speakers in the world. Her case is crucial for genetic research, as it allows scientists to better understand lipid metabolism and the mechanisms of cellular aging. By exposing her vulnerability, she transformed a genetic anomaly into a powerful lever for social change, advocating for kindness and the acceptance of physical diversity. Her life demonstrates that an individual's value does not lie in their appearance, but in their inner strength and positive impact on society. Number 6. Nadia Lauricella, empowerment in the face of Phocomelia syndrome. Nadia Lauricella, originally from Sicily, was born with Phocomelia syndrome. This congenital condition manifests as the absence or incomplete development of the upper limbs, as well as severe malformations of the lower limbs, often accompanied by pronounced scoliosis. Historically associated with exposure to certain medications during pregnancy, Phocomelia imposes drastic physical limits from birth. However, Nadia chose not to define her existence by her structural limitations. After an adolescence marked by social integration challenges, Nadia transformed her disability into a vector for radical empowerment. By committing to a rigorous physical discipline, specifically bodybuilding and adaptive fitness, she has become an emblematic figure on social media. With millions of followers, she uses her platform to promote self-acceptance and deconstruct traditional beauty standards. Her medical and personal journey proves that physical functionality is malleable. Thanks to remarkable neurological adaptation, she performs daily tasks with impressive dexterity, using her feet to compensate for the absence of hands, illustrating the incredible plasticity of the human spirit and body. Number 5. Sophia Weaver, the fight against Rett syndrome. Sophia Weaver represented one of the most complex cases in contemporary pediatrics. She suffered from a rare combination of facial malformations, hand and foot deformities, and Rett syndrome. The latter is a severe neurological disorder that affects brain development, leading to a loss of motor skills and speech. Doctors described Sophia as the rarest of the rare, as her constellation of symptoms had only been observed in a tiny number of families across the globe. Her life was marked by more than 25 major surgeries aimed at stabilizing her vital functions and reducing chronic pain. Beyond the purely clinical framework, her mother, Natalie Weaver, became a fierce advocate for the rights of medically complex children. She fought against online stigmatization, making Sophia's story a symbol of human dignity. Sophia's passing in 2019 marked the end of a medical battle of rare intensity, leaving behind a profound legacy regarding the care of orphan pathologies and the importance of ethics in pediatric palliative care. Number 4. Cynthia Murphy, resilience against Treacher-Collins syndrome. Cynthia Murphy was born with Treacher-Collins syndrome, a rare genetic condition that disrupts the development of facial bones and tissues during embryo formation. Affecting approximately 1 in 50,000 births, this pathology mainly affects the cheekbones, jaw, and ears, often leading to respiratory and hearing difficulties. For Cynthia, this meant undergoing more than 16 major reconstructive surgeries, including bone grafts and jaw reconstruction to secure her airways. In addition to permanent clinical challenges, Cynthia had to navigate an often hostile social environment marked by school bullying related to her facial difference. She successfully transformed her trials into a driving force, creating a non-profit organization dedicated to supporting people living with craniofacial differences. Her story illustrates the successful transition from chronic patient to thought leader. Her medical case highlights the importance of progress in maxillofacial surgery, while reminding us that a patient's healing also depends on social reintegration and the strengthening of self-esteem. Number 3. Marie, the mystery of alopecia and psychosocial impact. The case of Marie, a 30-year-old woman, presents a mysterious clinical manifestation where she loses patches of hair systematically and inexplicably during her sleep. Although this condition may resemble a severe form of idiopathic alopecia or dermatological disorders linked to extreme stress, it remains a diagnostic challenge. The impact of this pathology goes far beyond the aesthetic, as it shattered her professional aspirations in modeling and plunged her into dramatic socioeconomic precariousness. In addition to visible physical symptoms, Marie suffers from untreated mental health issues exacerbated by stigmatization and social isolation. Her story highlights critical gaps in healthcare systems regarding rare or unidentified diseases that do not fit into classic Social Security categories. Her journey underscores the importance of a holistic medical approach, where psychological and social support is as much a priority as dermatological treatment. Her case remains a call for better care for patients whose symptoms escape traditional classifications, thus avoiding their marginalization. Number 2. Melissa Blake, redefining visibility with Freeman-Sheldon syndrome. Melissa Blake is a renowned journalist and activist living with Freeman-Sheldon syndrome. This is a rare genetic anomaly, also called whistling face syndrome, due to the characteristic shape of the mouth. This pathology affects joints, muscles, and facial features, causing permanent contractures. Melissa has undergone more than 25 surgeries throughout her life to improve her mobility and essential motor functions. Rather than retreating from the public sphere, Melissa used her writing to become an influential voice in political and social journalism. Her commitment took on a global dimension when she responded to hateful online comments with a viral selfie campaign, reclaiming her place in the digital space. A journalism graduate, she has published major works dealing with ableism, discrimination against disabled people, and the perception of difference. Her case is exemplary. It demonstrates how academic expertise and strength of character can combine with a rare physical condition to transform cultural narratives and impose a more inclusive vision of human diversity. Number 1. Redzia Begum, the challenge of lymphatic filariasis. The final case is that of Redzia Begum, a Bangladeshi woman suffering from massive swelling of her right leg, with its weight estimated at approximately 60 kilograms, 132 pounds. This pathology, which appeared after her second pregnancy 18 years ago, is an extreme form of lymphedema suspected to be caused by lymphatic filariasis, also known as elephantiasis. This parasitic disease, transmitted by mosquitoes, obstructs lymphatic vessels, causing massive fluid accumulation and tissue hypertrophy. Redzia's condition has made her totally dependent on her family for the most basic tasks of daily life. Her case tragically illustrates the consequences of neglected tropical diseases in regions where access to advanced care is limited. Due to a lack of advanced diagnostic tests and access to complex lymphatic reduction surgery, Redzia lives in constant suffering. Her story is an alarm call regarding global health inequalities, reminding us that behind every rare medical case, there is an urgent need for international solidarity to offer dignified treatments to the most vulnerable populations. Number 11. Unforeseen cases. The story of May. May was a living challenge to the norms of her village. With her immense ears, her frosty braids, and her unusual beard, she suffered the cruelty of a community frozen in the past. Insults rained down, attempting to break her unique spirit. Yet May stood tall, finding her strength in her own truth. She understood that her beauty did not require permission. Her rarity, far from being a flaw, was the reflection of a courageous soul who dared to be totally herself. Message of comfort to May. Stay proud of who you are, because authenticity is the purest form of beauty. These stories illustrate biological complexity and the strength of the human spirit in the face of medical adversity. By documenting these rare cases, medicine progresses toward an understanding of human diversity, celebrating resilience and hope despite clinical challenges. Okay,